Nowadays, I think there are two types of people who take up ophthalmology. People who want to close the clinic at 5 a.m. and go home, and people who are full-time ophthalmologists, that is, who take up surgery. I think it's very important to be a good surgeon, to be a perfect, at least a good ophthalmologist. Dr. Smita.
Good morning, ladies and gentlemen. I shall be sharing some tips with you for training yourself with basic surgical skills. First and foremost, understand that experts can be made and are not born. You must have heard of the famous book Outliers, where Malcolm Gladwell advocates 10,000 hours of practice. So then only you can become an expert surgeon. So 10,000 hours of practice means, is it? Okay. So 10,000 hours of practice means you have to really go for purposeful practice. Also, professional skills are learned in distinct levels or stages. We learn ophthalmic surgery by watching our seniors and teachers. So basic skill is active observation. So spend time watching routine surgeries so that you are spot on able to find out when things are going to become awry. These are some of the expectations from a first-year resident. A first-year resident should be familiar with the operating microscope, its foot pedal, and also should know the ergonomic posture to be adopted while using it. You should also know the name and purpose of all the instruments for cataract surgery. You should know the settings of the phaco machine and how to prime and tune it. And you should also know the suture materials and how to practice under the small field of the microscope and appreciate the depth of suturing. So you can simulate a microscope at home using the camera of the smartphone. You can see that the props are distinctly homely. Then where can a beginner train? Obviously at the wet lab. So every institution should provide a wet lab 24/7. And that wet lab should have a steady supply of animal eyes. The first year PG should be training in the wet lab, and then only should be given parts of cataract surgery cases. It has been found that if you train on the day prior to your actual surgery at the wet lab, the results are much better. Just remember to keep the wet lab premises hygienic and clean. Then there is this not-for-profit organization, Help Me See, which helps you to train by using simulation devices. It trains both ophthalmologists as well as residents, and this is for free. But you have to make your arrangements for accommodation and food and travel to Mumbai. Thirdly, there are the various so-called low cost or frugal innovations, which are available in the form of videos. And these are usually like training on the lemon or on the grapes or on many other vegetables. These innovative videos are available on the YouTube, and here is a link for one of them. And then there are those wet lab trainings available at the national and international conferences. The advantage, I feel, is the availability of an instructor who is not only very well trained, who is also very courteous. Learning hand-eye coordination with the non-dominant hand is very important. Ambidexterity can be practiced by writing and brushing teeth or using the computer mouse with the non-dominant hand. Surgical videos are readily available on the internet, and this is a list of some of the channels for cataract surgery which are very popular. Now, these are some of the expectations from a second-year resident. A second-year resident is supposed to perform a case of cataract completely. So I would suggest that you or your institution keep a recording of a typical first case. Most of the videos that we have are usually made by experts. So these videos are either very fast or these videos are highly edited. So if you watch a recording of a typical first case, then the chances of you becoming disappointed after your actual case are very less. Please record your cases. It is not unusual to be surprised by what you see in the recording later on. And also, after each case, debrief with your mentor. discuss which parts of the surgery went well and which parts could have been performed better. I think confidence is critical in microscopic eye surgery. Confidence can be enhanced by repeated practice in the wet lab. And also, I think you can do mental relaxation techniques or affirmation techniques or any visualization techniques which act as boosters. More importantly, the confidence of the mentor is also transmitted to the protege. So the mentor also should be very confident. I feel capsular access is the most difficult part of cataract surgery. The Iowa surgical training curriculum lets the learner perform only this step of capsular access in a high volume surgeon's case. So if the learner starts to get into trouble, he or she is quickly relieved, and thereby they get numerous chances for this procedure. Now, these are some of the expectations from a third-year resident. Now, having these expectations is not enough. These must be measurable, these must be meaningful, and the goalpost should not move. Failure is a part of evaluation. All the PGs should know that. We have the PG logbook, which provides for continuous evaluation, but we also have the ICO Oscar, which is online and free evaluation tool for various surgeries. At this juncture, I have to tell you about simulation. High-end virtual reality simulation devices like the IC of the Hack Street and the Orbis simulation are important confidence booster, and they have very validated interfaces for basic surgical training. Then trials like the Olympics trials or the GLASS trials have shown that they are important confidence boosters as well as competence boosters. These are some of their disadvantages. They are very expensive, and each simulator has its own unique advantages and disadvantages. However, I think the way for us is to go for frugal innovations or the jugaads. And I want every one of you, the PGs, to take heart from the fact that everyone goes through periods of rapid growth and frustrating struggles as they learn to be a surgeon. Everyone who is attending this conference or any other conference or anywhere else. And to conclude, I'll conclude with a cliche. Technology is rapidly advancing, but there's nothing to beat the fact of learning from a skilled expert surgeon by watching or assisting that surgeon. Thank you very much for your kind attention.
Thank you, Dr. Smita, for that excellent talk. I would like to point out that in the medical college setup, the beginner as a surgeon always nervous, and the trainer as well as the trainee both are nervous. So from looking at this aspect, the role of wet lab is very much important, and if possible simulation training. So thank you for highlighting the necessity for wet lab in every teaching institution, and this also goes a long way in preventing complications, and also from the patient's point of view, from the patient safety point of view also, this is very